Hello students, welcome to Distinction Learning Platform, and on this platform you find revisions, test quizzes, explanation to difficult topics, so a lot of stuff. So before we begin our lessons, make sure that you subscribe so that you can be updated with all upcoming videos. To make the story short, let us begin. Don't forget to like the video. In this video, we're talking about AUB. AUB stands for abnormal uterine bleeding, which is under what? Obs and gyn, okay? And this is a case that we usually see under what? Gynecological ward, okay? So talk about the classification of AUB, the types, the causes, pathophysiology, treatment and diagnostic what procedures that you need to do if someone comes with what? Abnormal uterine bleeding, okay? So abdominal uterine bleeding, if you talk about the incident or the occurrence or the prevalence of AUB, it is what? So it affects about 50% of patients that are going to be diagnosed with what? DUB. Basically, AUB caused by what? Hormonal imbalance is going to affect about that. And it has been shown that people with DUB or dysfunctional uterine bleeding is affected about what? With those people with those that are between what 40 to 50 years. And the other important case is that it's also affect about 20% post-menarche patient. Very important to take note of that. Now, regardless of that, what is AUB? AUB, just from the word abnormal uterine bleeding, it's just the bleeding from the what? Uterine, or that is what? In abdomen, in what? Volume, frequency, and the regularity of what? The menstrual cycle. So what are we saying? So what we're saying about AUB is what? Abnormal what? So it's a bleeding. So we're saying bleeding. Okay. Bleeding from what? Uterine. Bleeding from the uterus. Okay. That is what? That is what? Bleeding that is abnormal. In what? So we're talking about the volume. So in what? So let me just use the blue marker for this. So abnormal in what? So we need to take note of this. Volume. Okay. What else? Duration. What else apart from the volume, duration? Frequency. Okay. And what? Regularity. So if you see any abnormality in volume, duration, and what? Frequency, and also regularity, basically they are going to experience what we call AUB, abnormal uterine bleeding. So that is a very, very important case. So you need to understand volume, duration, frequency, and regularity, because patterns of what AUB, they come from this same definition: the volume, duration, frequency, and what? Regularity. Okay. And what did we talk about? If we talk about the incident of what? AUB, we said 20% of cases, okay, affect what? Post-menarche patients. So post-menarche, those people that have what? That have attended menarche, then they are going to experience AUB. So post what? Menarche patient. Okay. What else? We said that also 50% of what? Patient, okay, with the age of what? 40 to 50 years. Okay. 40 to 50 years, okay. 40 to 50 years, okay. Then they're going to experience what? Also AUB. Now, since we've talked about the occurrence, the definition, what is the other best thing that you need to understand? We need to understand how they have classified abnormal uterine bleeding. What is the normal? What is the correct classification of that? So it is further classified into what? 3 main classes. What is the first one? There is what we call primary AUB. Okay, the first one is what? So let's say primary AUB, which is primary AUB. Okay, so primary AUB. What is the second one? Secondary. We know if there is primary, there is what? Secondary AUB. And don't say tertiary, but there is what we call iatrogenic. So iatrogenic AUB. Okay, 3 main classes. So primary AUB. What is primary AUB? Basically, primary AUB is it's a type of AUB where there are no what? Structural causes, like what? There are no polyps in the what? In the uterine cavity. There are no fibroids in the uterine cavity. If you don't see any structural cause of AUB, basically it will be placed under what? Primary AUB. So here, what about secondary AUB? Secondary AUB now is not because of what? It's not because of this. It's not because of hormonal imbalances. It is because of what? Structural causes. Sometimes structural causes are called what? Organic causes. Okay. Iatrogenic AUB is not because of maybe hormonal imbalance, not because of organic causes. It is because of what? Medical intervention. Maybe someone was under what? Contraceptive pills. Okay. Combined oral contraceptive pills. They inserted the IUCDs. Okay. Maybe they're under what? Drugs, like what? Warfarin, heparin. It's because of what? Medical intervention. Someone is having what? AUB. That is under iatrogenic what? AUB. Okay. So what are you saying about the primary AUB? We're saying it's because of two. Because of what? Hormonal what? Imbalances. Because of what? Hormones here. Then here, because of what? Structural causes. So let's just call them organic. Because of what? Organic. Here is because of inorganic. Here is because of what? Organic. But here for iatrogenic, we said because of what? Medical intervention. Medical intervention. Okay. So this is what I mean. Okay. Now, since we've understood also the classification of AUB, now let's understand the normal menstrual cycle. If we understand the normal menstrual cycle, now we're able to talk about the patterns of AUB. So the normal menstrual cycle, basically, it depends on this. The first one is what? So normal menstrual cycle, it will depend on the volume. Remember that it will depend on the duration, it will depend on the frequency, and it will depend on the what? Regularity. So let's start with the volume. Okay. So let's start with the volume. Okay. What is the normal bleeding volume that you know? The normal bleeding volume per cycle is what? It is about what? It's a range. Start from what? 30 mils to what? 80 mils per cycle. So what are we saying? So the normal volume of the menstrual cycle is between what? 30 mils per what? To what? 80 mils per what? Per cycle. Okay, this is the normal thing about the normal menstrual cycle. What else? Let's talk about the duration. The next thing is what? Duration. So what is the normal duration that you know for each what? Menstrual cycle. What is the normal duration? The normal duration is what? So it starts from what? 3 to what? 7 what? Days. Okay? 3 to 7 days. That is the normal what? Duration. Outside this range, basically, you are going to consider that as what? Abnormal. Very important to take note of. Okay? What else? So let's talk about also the frequency. There's also frequency here. So frequency. So frequency talks about how long is the menstrual cycle taking. Okay, it's basically it's between what? 21 to 35 days. That is the normal what? The frequency of the end menstrual what? Cycle. Okay, so what are we saying? Start from what? 21 to what? 21 to 35 days. So outside this range, you're going to have some certain terms that we're going to be talking about. Okay, so those are the important factors. Okay. And now, if you talk about regularity, okay, let's talk about it as well. So regularity, you need to understand. So it's different from frequency. So regularity, how regular the menstrual period is. So regularity. So let's talk about the regularity. So regularity, it has to be what? Less than or equal to what? 7 days. Discrepance. What do I mean? So what I mean is that maybe if someone had their previous menstrual period, the last menstrual period was on maybe 14th of that month. Okay, then basically for this month they are expecting as well for on what? The same day, which is 14. but it's not always that I'm going to attend on the next month, in the next month, on 14th day. No, maybe they can attend on what, 15, or maybe they can attend on what, 18, as long as it doesn't exceed what, 7 days. If it exceeds 7 days, now we're going to consider that as what, irregular. So that's what it means when someone says irregular menstrual cycle, regular menstrual period. Very, very important point to take note. Okay, so that's about the normal menstrual cycle, things that we need to consider. Okay, now from this, now let's try to come up with what, patterns of AUB. Okay, so now let's start with the first one. So we'll start with a volume. So there is a term that we use if the volume is what, greater than what, greater than 80, or maybe the duration is greater than what, 7 days. What do we call that? We call it what? Menorrhagia. Okay, what do we call that? So let's use the blue marker. So what do we call that term? We call it what? Menorrhagia. Okay, menorrhagia is what? Sometimes it was initially called what? HMB. Heavy menstrual what? Bleeding. Okay, it was previously it was called HMB, but basically what does it mean? It means that you have what? It's heavy what? Heavy bleeding. Okay, heavy bleeding. That is what? The duration of what? Greater than what? 7 days. Okay, so it has to have what? The duration of what? Greater than what? 7 days. And heavy bleeding, it means that the volume, it has to exceed what? 80 mils per cycle. Very, very important to take note of. So menorrhagia is what? It's a heavy menstrual bleeding that is prolonged, which is greater than what? 7 days. And then the bleeding has to exceed that normal volume, which is it has to be greater than what? 80 mils per what? Per cycle. Then you are going to say that is the menorrhagia. Very, very important to take note of, because from this you need to ask about the duration if you want to diagnose what AUB as what? Menorrhagia. Okay, what else? There's another term that you need to understand. There's what we call metrorrhagia. Okay, there's what we call metrorrhagia. Okay, there's what we call metrorrhagia. So what is metrorrhagia? Okay, what is metrorrhagia? Metrorrhagia basically now, it is the bleeding. Okay, it is the bleeding that is what? Irregular. So I'm going to use now this one. Irregular. You need to understand about this one. It's a bleeding that is what? Irregular. Sometimes metrorrhagia, they say bleeding between what? Periods. Okay, so what are we saying about metrorrhagia? Okay, so you see irregular. So I say we're using irregular bleeding between what? Periods. So this is a simple definition that I can give you. So irregular bleeding between what? Period. That is what? Metrorrhagia. So now, what does it mean? So you need to understand. Don't get confused. So let's say the same example that I gave you. Maybe someone their last normal menstrual period was on what? It was on 14th. Okay, quite right. They are expecting to start on what? 14th in the next month. Okay. Now, what if they begin on maybe let's say 7th of the next month? So they begin their normal menstrual period or their menstrual period on the what? 7th of the what? Next month. So that is the metrorrhagia. But doesn't necessarily mean that they are not going to attend on 14th what of that month or of the next what month. If they are going to attend, although they attend on 7th, but they are also going to attend on what? 14th. So don't get confused. Okay. So that's what it means, bleeding between what? Periods. So it is irregular. Reason being because it's going to be what? Less than what? 7 days. The discrepancy is going to be what? Greater than what? 7 days. Okay. Then it's going to be what? Irregular. That's what we call metrorrhagia. Let's go to another term. Very important term as well. Okay, so there's metrorrhagia. So what do we call that? The combination of this metrorrhagia. So basically, it's just the combination of these two. So we're going to have what? So these patients are going to have what? Heavy bleeding plus what? irregular. Okay, irregular what? Bleeding. Heavy plus irregular what? Bleeding. That's what we call what? Menorrhagia. It's just a combination of what? Menorrhagia and what? Metrorrhagia. Then that is what we call metrorrhagia. Very, very simple to take note of. Okay. Now let's go to other terms as well. So what about now? Since we've talked about terms that affect what? The volume, terms that affect the duration, terms that affect also the regularity. But what about frequency? We haven't talked about that. There are two terms that are going to affect what? Frequency. Okay. So let's start with the first one. Okay. Polymenorrhea. So polymenorrhea. Okay. So let's talk about this one. So polymenorrhea, basically these are what? Frequent bleeding from the uterus. That is less than what? 21 days. So we're talking about bleeding that are what? Frequent. So we're talking about frequent. So if you say frequent, they come early. Okay. Frequent what? Frequent bleeding. Frequent bleeding that's occur in less than what? 21 what? Days. So less than 21 days, then they are going to be what? Frequent. Now, so there is a term that they use. What about the term where there is what? Frequent bleeding, which is less than 21 days, and those bleeding, although they are frequent and irregular, but they are heavy. Basically, the combination of what? Menorrhagia and what? Polymenorrhea. What do we call that? We call it epipolymenorrhea. Okay? Epipolymenorrhea. That's basically the combination of what? Polymenorrhea and what? Menorrhagia. Okay? Basically, that's not even necessary. Okay? Now, what else? What else apart from less than 21 days? Well, there's also another one that can be greater than 35 days. What is that? Oligomenorrhea. Okay? What do we call that? We call it what? Oligomenorrhea. So, oligomenorrhea means that we're not going to say frequent. Now it's going to be what? Infrequent. Why? It is because it is greater than what? It's greater than what? 35 days. So we're going to say infrequent. Okay? Infrequent what? Bleeding. Infrequent bleeding which occurs greater than what? 35 what? Days. Okay? Yeah. And oligomenorrhea basically is as common in someone having what? PCOS. Okay? PCOS, which is polycystic ovarian what? Syndrome. Okay? And basically it's more common in what? Those adult patients like maybe greater than 40 years, like that. Okay? That is it. Oligomenorrhea. So what else apart from oligomenorrhea? There's also another term now, apart from frequency, okay, there's also another thing that's going to affect. What about now someone who is, let's say they are after menopause now, after 12 months, after 12 months now, they start experiencing what? Bleeding, okay? So basically, what do we call that? We call it what? Post-menopausal bleeding. So there's also that one. You need to take note of that. Post-menopausal bleeding. Okay. So basically that's bleeding after what? Menopause, and with a duration of what? 1 year. Okay. We're saying after 1 year, so greater than 1 year. So let's just say bleeding. Okay. After what? Menopause and okay. After bleeding. After what? 1 year. 1 year of reaching what? Menopause. Of reaching menopause. Okay. So bleeding after 1 year of reaching what? Menopause. So after menopause, then after 1 year, they start bleeding. That is, we are going to consider it as abnormal. Okay. So basically, those are the patterns of AUB that you need to understand. Now, let's go to the causes, because we understand the patterns, types, classification, incidences, definition. Now, what about what? The causes. What could cause someone to start bleeding in either they're going to have abnormal bleeding in what volume, duration, frequency, and what regularity. What could cause that? So the causes of that, my God, they are what? Simple to remember. It's because of what? There is a mnemonic that we use, which is palm coin. So there is this mnemonic which we use. We use what? Palm. We use palm. Okay. Then coin. This one. So palm coin, that is what? It's the one that we use. Palm is for what? Structural what? Causes. Palm, it is for what? Structural causes. Palm is for structural causes. Coin, that is for what? Non-structural causes. Simple and straightforward. Okay. So now let's start with palm. So P stands for something, A stands for something, L stands for something, M stands for something. So let's start with that one. Okay. So let's start with P. P stands for what? So P stands for what? Polyps. Okay. P stands for polyps. So polyps that can arise from what? From the endometrium or the cervical. So what do we call that? Endometrial polyps or cervical polyps. Those they can cause what? AUB. Okay. Very, very important to take note of that. So what are polyps? Polyps are just what? Are benign what? Growth that can grow in the what? In the endometrium or in the cervical region. Those are what we call polyps. They can cause that. What else? So what about letter A? Letter A, that is adenomyosis. Okay, adenomyosis. Adenomatrosis. Sorry, matrosis. Okay, adenomyosis. Okay. So what is adenomyosis? So adenomyosis, that is basically that endometrial tissue deposits itself in the what? Myometrium. That is what? Adenomyosis. So now if that adrenal tissue endometrial tissues are deposited themselves in the what? Myometrium, then from there, that's why what they will start what? Bleeding from. So they will bleed in the what? Myometrium there, and this causes what? Painful, heavy bleeding. Okay, so that is what adenomyosis. Okay, that is adenomyosis. So let's go to L. So let's use lead for here, or pink. So what is L? L, that is for what? Leiomyoma. So leiomyoma, basically the other term that we use is fibroid or fibroids. Okay, we call them fibroids. Okay. So again, these are also benign growth that grows in the what? In the endometrium there. Okay. These are basically the submucosa type, which is submucosa fibroid. These are the one that causes what? Painful what? Uterine bleeding. You should take note of that. Although others they can what? They can cause other types of leiomyoma. They can also cause what? AUB. But the most important one that you need to know is what? Submucosa type of what? Fibroid. Okay. What else? There I wrote M. M we all know that is what? M. That is what? Malignance. Okay. So malignancy can be what? Endometrial cancer or what? Cervical cancer. So those also they can cause what? AUB. Okay. Now let's go to non-structural what? Non-structural causes of what? AUB. Which is one of the, which is coin. Okay, coin is under what? Non-structural causes. So non-structural causes, basically there's no any organic there's no structure that is going to obstruct that's going to cause what? Cause AUB. Basically, like here, there are no like the polyps, adenomyosis, there's no leiomyoma, there's no malignancy there. So there are no structural things that can cause what? Bleeding. So there's nothing. Even if you get the ultrasound, you look at the what? The uterine cavity there will be nothing. There will be what? There are no structures that can cause what? Bleeding, like polyps and leiomyomas there. Now, what are those non-structural causes? So let's start with C. Okay. What is C? So C is what? C is what? coagulopathies or coagulopathies or coagulation disorders. Okay, coagulation disorders. Okay, or coagulopathies. Okay, so coagulation disorders like what? Or coagulopathy like what? The first one is which is the first one is what? Platelet disorders. Okay, the other one is Will-Bland disorder. Will-Bland disorders as well. Okay, so there are a lot of coagulation disorders. The other thing is let's say someone was under what? Drugs like what? Drugs that that affect the coagulation cascade like what? Offering and what? Heparin. So also you need to take note of that under coagulation what? Disorders. Okay. Then let's go to O. O stand for what? We know O stand for ovulator dysfunction. Ovulator what? Dysfunction. Okay. Ovulatory dysfunction. So there's a problem with ovulation there, okay? Or maybe in the ovaries that there's a problem. Production of progesterone and estrogen, they are what? Disturbed. That balance is what? Disturbed. Basically, if you talk about the PID, pelvic inflammatory diseases, and what? PCOS or polycystic ovarian what? Syndrome. Those are the one important. Those are the important diseases that can cause what? Ovulatory dysfunction, including what? Thyroid disorders, either hyperthyroidism or hypothyroidism. Those they can cause ovulatory dysfunction. Okay, basically those are under what? Non-structural causes. What else apart from that? There is also another one, E. We are going to say endometrial causes. So endometrial causes not due to what? These structural causes that we talked about, polyps and other things, no, but the endometrium looks normal, but basically there is a disturbance in the what? Hemostasis of the what? Endometrium there. So basically here what they observed is that there is increase in the what? Fibrinolysis, okay, pathways, and there is decrease in the what? Coagulation pathways, okay. So basically you are going to observe that. So disorders that can affect the hemostasis of the endometrium, they are under what? Endometrial what? Causes, as one of the what? Non-structural causes, okay. What else? Iatrogenic. Okay. Iatrogenic is because of what? So iatrogenic now is because of medical intervention. Okay. Maybe someone is under what? COX, which is contraceptive oral, combined oral contraceptive pills, that is COX. Maybe someone they've inserted the copper device there, or the ICD intrauterine device there. Okay. And maybe also some drugs like that which we talked about, like offering, okay, and offering, and also like maybe other drugs like heparin, because they are under what? Medical intervention that can affect what? Someone to start what? Bleeding abnormal. That's under what? Iatrogenic. There are a lot. Okay. And so as you can see, there is also in here, and it is stated not what? Classified. Why? Because some causes are what? Poorly understand. Wonder they are just they just put them under what? Not classified. Okay, you don't classify those that you are not clearly fine or understood. Okay, so that's under the causes of what? AUB. Now, since we've understood the causes of what? AUB, now we can proceed to what? The pathophysiology, which is so simple. Okay, so what can lead to what? Someone to start bleeding abnormally during the what? Menstrual period. Okay, so now we'll start with the what? The pathophysiology. We'll start with what? Non-structural what? Causes. Okay, so we'll pick which is the common one, which is the ovulatory dysfunction, leading to what? PCOS. Okay. So let's start with this one. The pathophysiology, just pick one because somehow they are like common like that, okay? Except for coagulation disorders. So somehow they have the common pathway here, okay? So let's start with this one. So ovulatory dysfunction is because of what? This one. Remember that if you talk about progesterone, okay? So let's talk about the most important hormone. So let's talk about the progesterone. So I'll just represent it with capital letter P. That is progesterone. Remember that progesterone is produced because of what? The corpus luteum that is there, okay? It's going to be produced, and the follicular cells there, they're going to start producing what? Estrogen. So let's talk about the most two important what? Hormones that are there, progesterone and what? Estrogen. Okay? So remember that estrogen is the one that will start the building up of the walls of the uterus, okay? Then followed by what? Progesterone after the formation of what? The corpus luteum. Now, there are some problems that can arise where progesterone is not produced, but estrogen is produced, like what? PCOS, okay? A lot of causes, thyroid disorders as well, they can affect this balance, okay? So now let's talk about what normally progesterone can do, okay? So the better problem is because of what? The lack of production of what? Progesterone. So what can progesterone do is what? So progesterone, what it can do is, if it is produced, it's going to make sure that, okay, it's going to make sure that there will be production of what? So it will stimulate the production of what? Prostaglandin. So prostaglandin what? Like what? So PG, so it promotes the production of what? So let me use this. So progesterone is promotes the production of what? Production of what? PGF2 alpha. Okay. This one, okay, and it also promote the production of what? Endothelin. Okay. Endothelin. So these two important what? Substances that are produced due to progesterone, they promote what we call vasoconstriction. Okay. Vasoconstriction, and also platelet what? Platelet aggregation. Okay. Platelet what? Aggregation. And remember that these ones, if progesterone promotes what? The production of prostaglandin and endothelin, it also promotes another important what substance, which is what? Thromboxane what? A2. Thromboxane A2 is the one that promotes platelet aggregation, and this prostaglandin F2 alpha and endothelin, they promote what? Vasoconstriction. All these, they are going to lead to what? What are they going to lead to? Okay. So formation of platelet plug and everything, okay? Then it will lead to what? Decrease in what? Bleeding, okay? Because those spiral arteries that were initially ruptured due to what? Maybe due to like hormonal withdrawal, then they are going to what? Those that are going to be left open, those spiral arteries, if they are left open, this has to happen, okay? Platelet aggregation, vasoconstriction, okay, everything that's favoring what? To decrease the bleeding from the what? Spiral artery. This is the normal thing that's going to happen, okay? Hence the what? Coagulation of those what? Blood vessels. Now the problem is now let's say someone had what? Like this ovulator dysfunction, like what? PCOS that we talked about. In PCOS, what's going to happen is this, okay? Now, let's talk about the pathophysiology now, the disorder. This is a normal thing that's going to happen. Now, the disorder is like this. Someone now having PCOS, okay? Someone having PCOS, what's going to happen? There'll be low production of what? Progesterone. Low production of what? Progesterone. If there is low production of progesterone, it's going to lead to what? Low production of what? This prostaglandin that we talked about, okay? Prostaglandin F2 alpha, okay? And low production of what? Endothelin. And also low production of what? Thromboxane what? A2. This will lead to what? If you have low production of all those things, will lead to what? Okay? Decrease in what? Vasoconstriction, okay? What else? Leading to what? Decrease in what? Platelet what? Aggregation, aggregation. What else? Then it will lead to what? Now, increase in what? Bleeding. So, that is what? The pathophysiology under what? Non-organic cause. Make sure that you understand how it leads to what? Bleeding, okay? So, this is the thing. So, here, if there is low production of those prostaglandin that we've talked about, bleeding now will start what? Occurring like that, okay? Due to what? This ovulated what? Dysfunction. Now, what about the pathophysiology that can arise due to what? Structural causes, okay? Now, this one is because of what? So we'll just write it here because it's very, very simple thing. if there's a structural cause here, so there's a structural cause, let's say this is a polyp that is there, okay? Or maybe there are what? Myomas that are there, or leiomyomas that are there. What do? So these, they are going to decrease what? Contraction, okay? They are going to increase what? Vascularity, okay? They are going to increase what? Vascularity of the area, okay? So two important things that they are going to do, although there are a lot of things that they are going to do. The first one is what? They are going to decrease the contraction, okay? The contraction of the what? Myometrium. Due to what? Because they are obstructing the normal function of the what? Myocyte within the myometrium. Then they are going to decrease what? The contraction. Remember that contraction is very, very essential when it comes to what? Vasoconstriction of what? Spiral arteries, okay? What else? There is also increase in vascularity. Vascularity, basically, there will be what? Low blood supply to the what? Uterine, abnormal blood supply to the what? To the uterus or uterine lining, due to what? The presence of this, okay? Due to this, and these things, they also, these structural causes, they also what? They promote what? Higher sensitivity to the what? Estrogen, okay? Due to that, now, because of all these things, they can lead to now increase in what? Bleeding, okay? Increase in what? Bleeding. Very, very important pathophysiology that you need to what? Take note of, okay? Now, since we've talked about the pathophysiology of what? AUB, now let's talk about what? The clinical features and what? Also investigation management of what? AUB. Now, let's talk about the treatment and also diagnosis, okay? So, first of all, so when we start talking about the clinical features, first of all, a patient comes with maybe prolonged or heavy menstrual bleeding, okay? So what are you supposed to do, okay? So what you need to do is what? You need to take history, okay? After history, you need to do what? Exam. Then also, lastly, you need to end with what? Investigation, okay? Now, from history, what you need to take note of what is the same thing that we talked about, because this someone with abnormal uterine bleeding is what? They come with what? Abnormal in volume, duration, frequency, and what? Regularity. So to ask about that, okay? You ask about the duration of the bleeding, okay? The frequency of the menstrual cycle. You ask about the duration as well. You ask about what? The volume. You ask about that, okay? Also ask about, is it related with pain, all those things, okay? And also ask about the symptoms of anemia, like headache, generalized body weakness, like that, okay? Dizziness, a lot of what things that you can ask from history. So what are we saying about the clinical features that you can do? So there will be what? First one is heavy bleeding or menstrual what? Bleeding. Those are the things that you can see, okay? You can also look at maybe there will be what? Dysmenorrhea. Basically, there will be what? Those are painful what? Menstrual what? Bleeding, okay? What else? What you can see? Signs and symptoms of what? From the clinical features, signs and what? Symptoms of what? Anemia. Very, very important. Okay, palpitations, those small things. Okay, start palpitations, palpitation, lightheadedness, weakness, cold extremities, those things that you are going to observe, okay? Very important signs that you need to take note, because they are going to help you also in the what? In the management of AUB, okay? So, now, if you do all those things, then you do also the general exam. You do the general exam, the general appearance of the patient, nutritional status. You also look at the respiratory system, look at because these people, they are also prone when it comes to infection. You do the respiratory exam, cardiovascular exam, you do GIT exam, you do also a genitourinary exam. So you do all the exams that you're supposed to do, okay, according to the symptoms and signs the patient is having. After you do all those things, what is the other thing that you need to do? You need to do what? Investigation, okay? So investigation also, it will depend on the what? On the cause that is there. A thing that you are suspecting that someone is having that. due to what the issue that you did and also the exam that you did. So what's the first thing? Okay, so remember that the first thing that you need to do, the first and important what investigation that you can do, because AUB, some people they can bleed due to what? Pregnancy. So exclude what? Pregnancy. Okay, so what do? You do pregnancy what? Test. Pregnancy test. Okay, that's the most important one, where you look at what? Beta what? HCG what? Levels. Beta HCG levels in blood. Okay, look at that. You exclude that. What else? Apart from doing that, now that's where you do now the full blood count. You do what? The full blood count. Okay, where you now look at the severity of the anemia that they are having. Okay, and also it will show if they are having infection. There it can show the full blood count. Okay, and differentials. What else? You can also look at what the clotting. So let us put here the clotting or coagulation profile. So you can also do coagulation what? Profile. So coagulation profile, what's going to show you? So the coagulation profile is going to show you it's going to show the platelet count. If some maybe they're having thrombocytopenia, okay, it's going to help you to see the PTT time, which is prothrombin time. Also partial thromboplastin time. It's going to help you that. Okay, D dimers, also fibrinogen what levels. It's going to help you if you do what? The coagulation profile, because coagulation disorders are also one of the what non-structural causes. Okay, make sure that you do that. Okay, what else? Also need to do imaging. You need to do imaging like what? Ultrasound. Ultrasound is going to show you if there is a structural cause. It's going to show on the what? Ultrasound. Like structural causes like what? Polyps. Okay, polyps, leiomyoma, malignance. Okay, so this is the endometriosis. Okay, it's going to show you all that under what? Under ultrasound. Okay, now after you do all the investigation that you're supposed to do, okay, now what else are you supposed to do? Now you should, due to this, you are going to do what? Management. Okay, this is just the general management. Okay, so management will depend on the what? So it will depend on the medical management and also surgical management, dependent on the severity of what? AUB. Okay, so what are those medical management? What can you do? So here you can give them what? You can give them progestins. Okay, you can give them progestins. Okay, if you give them progest, you can give them that. Okay, you can give them also estrogen. Okay, so this is under medical management. What else you can give them? You can give them tranexamic acid. Okay, tranexamic acid. Okay, you can also give them that. Okay, so that's under medical management, although there are also other drugs that you can give. Okay, then under surgical management, okay, maybe there are something maybe medical management is not possible. Then the last resort that you can do is what? Surgical management. So you can do hysterectomy. Okay, you can do here hysterectomy. Okay, where you just remove the whole uterus, because the one that is causing what? Bleeding, you just remove it. But this one is recommended when a patient is like doesn't have plans for future children like that. Okay, because if you do hysterectomy, total hysterectomy, basically you are not going to be like to have children. Okay, so basically you need to consider also the fertility of that person. Okay, you can also do myomectomy, where if myomectomy basically if someone is having leiomyomas, so if they are having leiomyomas, you can perform myomectomy. Basically myomectomy is a safe procedure. It can't affect what? Fertility of a patient. Okay, so you can also do polypectomy, because polypectomy also you need to remove what? The polyps there. Okay, and also the last one, you can also do endometrial what? Endometrial ablation. Endometrial ablation. Okay, so those are the things that you can do under general management. Otherwise, but if you look at the management that you can do, basically if someone comes with severe AUB, they are in shock. What you need to do is, remember, the first thing that you need to do is what? You need to resuscitate that patient by using what? ABCs. After that, you stabilize the patient. You do introduce IV. You gain IV access there. So whereby you just treat the what? The shock of that person. After doing that, now you start doing all those things, medical management, surgical management, and like that. Okay. So now that's why we end from what? The AUB. And we'll talk about in the next video. We'll talk about something else apart from abdominal uterine bleeding. We'll talk about amenorrhea. Okay. So make sure that you subscribe so that you don't miss any upcoming videos. Okay. Don't forget to